Good afternoon, everyone. My name is Jerome Bailey, and I'm with the ESRD National Coordinating Center. Thank you for joining us today for the ESRD NCC Patient Education Quick-and-R. The ESRD NCC Quick-and-R events are held in partnership with the Centers for Medicare and Medicaid Services. We are hosting these 30-minute events weekly. They feature patients and professional subject matter experts from around the country sharing how they or their organization are coping with situations related to COVID-19. Before we get started, I wanted to let you know this call is being recorded and will be posted to the NCC COVID Quick-and-R webpage. Let's take a look at the agenda for today. So today we have two speakers. First, Precious McCowan is a two-time kidney transplant recipient from Lancaster, Texas. She was diagnosed with kidney disease in 2010, receiving her first kidney and pancreas transplant that same year. The kidney failed after 7 months. Precious then went on to receive in-center hemodialysis for 8 years, during which time she started her patient advocacy journey. She's done volunteer work for the ESRD Network 14 of Texas. She is a CASER subject matter expert, and CASER stands for Kidney Community Emergency Response Program. And she is a National Kidney Foundation peer mentor. Precious received her second kidney transplant in April 2019, so a little over a year ago, and she is currently pursuing her doctorate degree in the field of human behavior. Also joining us is Lisa Rodriguez. Lisa is a registered nurse and serves as the transplant coordinator, kidney outreach nurse at UC Davis Tranplant Center in Sacramento, California. Her experience includes inpatient kidney transplant surgery, post-operative care, and living donor surgery post-care. Lisa has a special interest in educating Hispanic patients in her community, helping them to understand the kidney transplant process. Her role at UC Davis allows her to provide transplant education classes in Spanish. Both speakers will be sharing tips on what patients can do to prepare for kidney transplantation in the era of COVID-19 and social distancing. Our panelists go through, as our panelists go through their presentation and you have questions, please submit them using the chat feature through WebEx or the Q&A on the lower right hand of your screen. When we get to the question and answer section of this presentation, we will share the questions we have received with our speakers. Our goal is to answer as many questions as time allows. So what about this call? You will hear tips on what you can do to prepare for kidney transplantation. We will share some real-world experiences that you can put to use. We have some resources for you to use and share with others. And this series of calls is available to you weekly, and we have a variety of topics. So I will now like to begin today's discussion with Precious McCowan. Precious, thank you for joining us.
Hi, thanks for having me today. Thank you.
Awesome. Well, what changes to your healthcare have you experienced because of the COVID-19 pandemic?
Well, since the pandemic, currently I do not have the luxury to retrieve my my lab the same day and to go over them in person with my transplant team. I always seen that as being a benefit. I get my labs drawn in like 30 minutes, the labs are available. Since the pandemic, patients at my transplant facility have been asked to get their labs drawn at a nearby laboratory. And with the laboratory, labs take some like 3 to 4 days to come back. However, I have been using the patient portal more often because once the labs are ready to be evaluated, it is posted to the portal, and from there I have access. So it's kind of like a give and take. So I've lost something, but I've gained as well.
Okay. Are you using telemedicine for your doctor visits?
Yes, I do. I use telemedicine for my transplant with my transplant provider, and also with my GI physician. And
Is there?
mhm.
No, I was just going to ask: is there anything special you have to do to prepare for those visits? You know, what are some of the benefits of using telemedicine?
Yeah, like to prepare for those visits, a nurse or someone from those clinics would give me a call 30 minutes in advance before my appointment, and they would ask me to check my blood sugar, my blood pressure, my temperature, and my weight. So those are the things that I have to do to prepare for those televisit calls. And as far as like the benefits, yes, there are benefits with that. I actually feel more comfortable. I've actually noticed that my blood pressure readings are a lot lower than they are when I go into the clinic. I think with any physician clinic that I walk into, I experience a little anxiety, so that's a plus. Also, another benefit is that my provider, actually, I feel that my providers are taking more time with me to go over any questions I may have. I've noticed that with my labs, they have like thoroughly went over my lab and answered any questions and actually, you know, took the time to explain it. And I think with this, with telemedicine, providers also may feel that they have more time to spend with patients, and it's not just rush, rush, rush. So I do appreciate that.
Okay. What steps have you been taking to ensure you stay healthy and avoid exposure to COVID-19?
Yes, that's a good question. Well, I am still practicing social distancing. I have not yet visited with any of my family and friends, and this is mainly because I do recognize that I am vulnerable to COVID-19, you know, being a recent transplant patient, and also, you know, being a diabetic. So there are other health conditions that make me vulnerable to COVID. I also wear a mask when I'm in public. I keep hand sanitizer on board. I wash my hands several times a day throughout the day. Even if I'm just like, you know, hanging around the house, I still wash my hands. And for me, the wearing of the mask, washing hands, and using hand sanitizer is not out of the box for me. This is something that I've been practicing since I received my transplant, and especially during flu season. And most of all, I always make sure that I stay away from individuals that are sick or feeling sick. And just a really quick funny story that I would like to share is that a little while back, my husband had an allergy flare. His allergies flared up, and he was coughing and sneezing. He didn't have a fever. However, I directed him to just stay in another room within the house for a couple of days just to be sure. So I really take this COVID-19 pandemic very seriously.
Good for you. And, you know, earlier in your introduction, I mentioned that you had a kidney rejection. What led you to get on the transplant wait list again?
Yes, and you're right, Jerome. I received my transplant in 2010, and it only survived for 7 months, and that was both the kidney and pancreas transplant. During that time, I was, you know, kind of discouraged that I had to start dialysis again. I remember as my body began to heal and, you know, I began to get back on track with my health, my nephrologist actually approached me, and he told me that he thought that I would be a great candidate to be listed for a kidney transplant again. And, of course, I had my doubts, and, you know, I thought about it, and I even brought the conversation up that I had with my nephrologist to my primary care physician, and she agreed. And so with both of them being in agreement that I should be relisted, I was relisted. However, I did not know this go around I would have to wait 8 years versus the 4 months that I waited the first time. But during those 8 years, Jerome, I was able to learn so much about kidney transplant. I was able to learn about the challenges, the risk, just different things that you can experience with the transplant. I didn't know all of this information when I received my first transplant. So during this wait, that 8-period wait, I was able to retrieve a lot of education about transplantation. And so now I feel like I'm ready. So I'm ready.
Good. And just one last question. Making the decision to go for another, transplant. The first transplant wasn't easy, but you decided to go for it again. Why do you think patients should consider kidney transplantation?
I think that, patients should consider transplant is because, to have a shot at a better quality of life and health, it's another modality. There are pros and cons of a transplant, but I think to give yourself a chance at a better quality of life and health. Also, to be free from being confined to a dialysis machine several times a week, that literally makes you feel like it is sucking the life out of you. Free yourself from that. And another reason why a transplant should be considered is because, just to feel like yourself again. And for some people, for some individuals, that means, returning to the things that you used to do before kidney failure. So basically to feel alive again, to feel whole.
Precious, thank you very much for being with us today. Just hold on a little bit more. We are now going to turn the call over to Lisa Rodriguez with the UC Davis Transplant Center. Hi, Lisa.
Hi, good afternoon to everybody, and thank you for the invitation to share a little bit of information with the patients who are preparing and waiting for kidney transplant, hopefully in the near future.
Well, we are excited to have you with us this afternoon.
Great. I'm excited to be able to share some information. Thank you.
So, Matt, do you want to go to the first slide?
Okay. So let's get started. My role here as a transplant coordinator is in the pre-evaluation phase, and one of my main responsibilities is to educate the patients as they're entering our transplant program, and that's with our Education First class. Our program, our transplant team, feels very strongly that one of the most important things for patients entering the transplant process is to understand fully the evaluation process, the listing process, and of course the surgical process and recovery, and what is ahead of them. We really want them to understand what their role is, what their responsibility as a patient is, and what they're looking at in the near future. So this slide here I presented, or I prepared the first one. We want our patients to know, what the transplant team's care plan for them is. If they're young, if they're old, the testing may vary just a little bit. The next thing is we want patients to be speaking with their pre-transplant nurse coordinator or their waitlist nurse coordinator if they have any questions about their testing or their testing results. And many times patients, as they start the evaluation process and they're doing their tests, they think that the tests are here in our office or that that the provider they had the test with have arrived at our office, and many times it has not. So during this COVID period, Patients have the stay-at-home order, or, they're more likely to be at home and not out running around in our daily lives, most of us. This is a good opportunity for the patients to reach out to their providers where they had testing and say, hey, I'm trying to get on this transplant wait list, or I'm in an evaluation process. Can you make sure my test results are faxed over to my nurse at my transplant center, my transplant program, and then follow up and talk to your nurse coordinator or the administrative assistants that are working with your nurse coordinator and confirm that your test results are there so that things can get moving and checked off your list. And that way you can get listed or complete your evaluation in a more timely manner. The other thing is some patients may be already active on a wait list, on our wait list or on another program's wait list, or on multiple transplant center wait lists. And there are annual tests and screening, like for cancer, or annual health screening, mammogram for women and pap smears, and blood tests like prostate-specific antigen for men over 50. You may want to call in and check in with your nurse and say, hey, is it time for my annual test? I had them done, and I just asked my provider or physician to send you those results. Did you receive them? That's very important as a patient so that things can move along quickly. Because the fact of the matter is, here in California, our waiting times are increasing. We're a large state. There's a large volume of people with end-stage renal disease in California, and as those wait lists and patient volume gets longer, transplant centers are inundated with that volume. So it helps the program. It helps your coordinator if you check in with your coordinator, annually and say, hey, I did these tests, and they're being sent to you. Did you receive them? That's a patient responsibility. And next slide. Now, preparing yourself for transplant. There are, what I want to say here about this slide is, transplant programs, there are responsibilities we have as a program, and there are things that we have roles and that we need to do in order to transplant you. And then as a patient, there are responsibilities that you share that you must do and kind of do your part. We each do our part, and then we meet in the middle, and that's when hopefully the transplant surgery will take place at some point. Now during the COVID period, this is a great time. It's summertime or springtime in many parts of the country. And one of the most important things, and I cannot advocate this enough, are transplant physicians, transplant surgeons. One of the most important things is they want our patients to stay active, and by doing that, they want you to do whatever form of exercise you can do to keep your strength up, to keep your conditioning up. And to me, a very simple thing is, if possible, not everybody is able to, walk briskly or walk on a regular basis due to, sometimes it's medical reasons or sometimes it's various limitations. But if you are able, we would like you to be walking a minimum of 30 minutes a day or every other day, because when you come for your annual reevaluation here at UC Davis Transplant Program, our transplant physicians are going to walk you around in the clinic, and they're looking for strength, gait, stability, conditioning, and then they're also going to walk you up 3 or 4 flights of stairs, which is about 30 to 40 stairs, and they're going to check you for frailty, conditioning, strength, which is a very big predictor after transplant surgery. So you have time right now, COVID, we all have a lot of time now, and this is a very good way to spend your time with your family, loved one, friends, walk your dog, and get some sun and exercise in. The other important thing is we want you to do your best. I tell patients, nothing's perfect in life, but do your best to stay healthy and well. And what we mean by that is, eat the best you can, follow the CDC guidelines about the social distancing, wearing a mask, and hand sanitizer. We also want you to think about looking at your support person or your support team, persons who are going to help you with the transplant process and recovery. Make sure that they are still in your life, they're still supportive, if not. And some patients have to replace them with someone new because things happen in people's lives, and support people can come in and out of your life during the waiting period. Now, the other item is There are many people who have lost jobs and might have lost insurance at this time during COVID with the current state of the country and the world. If you lose your insurance or have a change in your insurance, please notify your transplant team or our transplant team if you're listed with us. We also want you to do your best and do not skip dialysis during this current time. It's very important to get your treatment to stay healthy. We also want you to take a moment and review your medication list with your dialysis team so that if you're active on our wait list and you get called in, our transplant team, one of the most important things is they're going to look at all your lists of medications. They have to review them, check them, and get them into our electronic medical record prior to surgery. So keeping a current list with you at all times is very important. And if you become ill, hospitalized, notify your nurse coordinator, notify our team. And most importantly, if you are active on our wait list and you become COVID positive, we need you to notify us. Next slide. Next slide, please. So, and here we go. So preparing yourself for transplant continued. The UC Davis Transplant Program continues to perform kidney transplant deceased donor who are COVID negative. So since early March, when the COVID-19 pandemic, kind of came into full blown here in the United States, UC Davis Transplant Program, we were very fortunate, and we have been able to transplant over 30 patients, deceased donor transplant during this COVID period. Like I said, we were very lucky here in the greater Sacramento region, and a big thanks to our transplant surgeons who were diligent with testing and being very careful and cautious with that, and all 30-plus patients were transplanted successfully and doing quite well currently. So the other item is here, when we say staying well, we want you to follow the Center for Disease Control Prevention guidance on how to protect yourself. And like as I said prior, mask, distance, and hand sanitizer. And if you are active on our wait list and you become diagnosed with COVID-19, it will not be safe for us to transplant you until you're fully recovered, and that could be up to 6 weeks, 4 or 6 weeks, depending on the severity of the COVID case, and depending on our transplant team. Each case is individual. If that were to occur. If you've been exposed to someone with COVID-19 and you are in quarantine, it will not be safe to transplant you until a minimum, we say a minimum of 2 weeks, but it may be more like 4 to 6. We also want you to know that our transplant team is committed, and our team is here for you 24/7. And if you have any needs, please feel free to reach out and contact us, and we're here to assist you with any of those needs. Let me see, next slide. And
so, Lisa, it's Jerome, and so I'll take over for a little bit and encourage anyone that has a question for either of our panelists to please send a message to us in the Q&A section or using the chat feature in WebEx. We did get a couple of questions already, and the first one is for Precious, and it says, how do you like using telemedicine for post-transplant? Did it take a while to get used to not seeing your doctor face-to-face?
I actually like telemedicine, especially if I feel well. Now, if I'm feeling kind of ill, I would like to be seen, but I like it. I felt comfortable, and the process was really easy. Like I said earlier, the nurses or the clinicians at the clinic, they made sure that I knew what to do, that I received the link, that I knew how to operate the link, and they also did a test run to see if they could see me and to see what the doctor would see. So they made sure that I was prepared. So it was an easy process.
Okay. Thank you, Precious. Our next question is for Lisa. What happens if you forget to complete your annual visit test?
Well, there's a couple of things. I guess the most important thing is, we all have busy lives, and we understand people are working, families, and dialysis treatments. That can be a very busy, hectic schedule. If a patient missed their annual test, I think the most important thing to do is to contact your nurse coordinator if you're listed with our program or whatever transplant program you are currently listed, meaning active on their wait list, and just let them know. Just be, truthful and just say, I missed my appointment, I missed my testing, and how or when can I reschedule that as soon as possible, and what tests do you need me to do? That way they can contact their provider and get those tests scheduled, because many tests take, several weeks or a little longer to complete. So I would just contact their transplant team or nurse coordinator or administrative assistant as soon as they can.
Okay. I think this next question is for Lisa as well. How many COVID-19 tests are done to the candidate before the transplant?
So before the transplant surgery occurs, our transplant surgeons, they have a test done on the deceased donor organ, and they do a blood test on the recipient, which would be the patient that's active on the wait list.
Okay. Question for Precious. How long did it take you to decide to go for a second transplant? And how did you keep your spirits up by being on the list for 8 years?
Well, after I had that conversation with my nephrologist when he suggested I should be relisted, it took me like around 2 months before I decided to just go ahead and step out and make that decision and complete the transplant evaluation. And during that 8-period wait, what kept my spirits up is advocacy. Being engaged and being involved with my peers from ESRD Network 14, from the NCC land, and other kidney organizations, connecting with them and just, having that platform to share my concerns and how I'm feeling is what kept my spirits up during that time.
Great. And I think we have time for one more question, and it's for Lisa. And it says, I'm on the transplant wait list. If someone in my family becomes COVID-19 positive, will that impact my ability to receive a transplant?
Well, if you have somebody in your family who's positive for COVID, you should notify your transplant team, because COVID-19 is a highly infectious virus. And most likely, when one person in close proximity in a family, typically the rest of the family members may contract the virus or possibly contract that virus. So you should notify your transplant team if there's somebody who is COVID positive in your family and they are living with you, or you've been exposed to them, or socializing with them or interacting with them. That's very important. So they would probably, your transplant program may conduct some testing or have you go to your primary care physician for a COVID-19 test, and then they will move forward from there.
Lisa, Precious, thank you both for being with us today. We really appreciate the great feedback that you both provided.
Oh, you're welcome. My pleasure.
You're welcome.
Thank you for the invitation.
You're welcome. We'd now like to introduce a new resource from the ESRD NCC. It's called the kidneyhub.org. This is a great resource we've been getting a lot of great reviews from our patients about. It's secure, mobile-friendly, with directions from patient volunteers. It's a new resource for patients and professionals. It has links to COVID-19 information, transplantation, home dialysis, infection prevention, and more. The goal of Kidney Hub is to help patients and family members make well-informed healthcare decisions. So Our next patient webinar event is next Tuesday, but tomorrow we will hold the professional webinar event with Dr. Tushar. She will present on ways to increase nephrologist comfort in managing home dialysis patients during COVID-19. Thank you all again for being with us this afternoon. It is 5:30 exactly. For additional COVID-19 resources, visit the CASER website at casercoalition.com. You can also review additional COVID-19 tools at kidneycovidinfocenter.com. Thank you, everyone. Have a good evening.